Okay. Do you see, and are there any common kind of huge faux pas or mistakes that you see people making or remediators making that might be helpful to know for our audience to know about, before they go and make the same mistake that could jeopardize their project?
Yeah. People haven't done well with ozonating their homes. It sounds like everybody wants a quick and easy way to fix this problem. I understand it, but that the ozone treating homes has made things worse for people. That I can say clinically. I have some theories about it, but that hasn't been helpful. Um, I send patients an article done in 2012 in Scandinavia about uh, remediation options. They deliberately contaminated wood and building materials with aspergillus and stachybotrys and tried to address them with ammonia, UV light, bleach, ozone, heating, hydrogen peroxide. Nothing worked. Nothing destroys mycotoxins. And I use that article to point out to people that whatever magic formula somebody's saying they can just wipe down with, it might be fine to wipe down after you physically removed and replaced the items, but to believe that that is that you've resolved the problem by wiping down or using a sprayer or a candle is it's not believable to me, and it doesn't turn out to be adequate. If it's done in addition to properly addressing the situation, it might be fine. Physically cleaning and removing that's never a bad idea, as long as it's done under containment where you're not, like you described with your wife, where you're not aerosolizing everything. It's okay to wipe down and clean. It's good.
Yeah.
Like a wet wipe, not to where you're not aerosolizing.
Yeah. Yeah. Microfiber with water.
Yeah.
Do you find that there are certain things if when people are getting out of mold, let's say they're leaving their house, um, and they're not sure what to leave behind and what to take, are there certain things that you would say absolutely don't take it with you when you leave?
Yeah. Paper. Paper really is not remediable. You just, paper is going to be the biggest problem. I would not bring any paper if there are documents that need to be retained. I would seal them in a box and have them somewhere else. Soft materials are the next worst. Bedding, anything in the bedroom, pillows, sheets, the mattress, sadly, I would really try and make a fresh start there. You really want your bedroom healthy, bedroom sanctuary concept. So I wouldn't want anything contaminated in the bedroom. In fact, bedrooms shouldn't have too much in general. It's just easier to have them, be clean and healthy. Soft materials that aren't in the bedroom, like clothes and couches. Clothes can be problematic, especially shirts, because they're just so close to where you're breathing. So if people are really trying to make their best effort at this, I would not bring clothing. I would not bring an upholstered piece of furniture. Those are going to be the harder ones to address. I generally ask people, I tell them that I have not had patients regret bringing too little to their new environment. I've had plenty regret bringing too much. If you bring a little bit at a time, it also becomes clearer later if you choose to introduce a single item. And I'm not sure if I shared this online, but during our experience, we were out of the moldy house. We brought in a single dresser that the remediator swore up and down had been completely cleaned. And that the next morning I had had night sweats. I was totally out of it. And our daughter spiked 104.5 fever. She was 6. And because we had brought in one single item, it was very, very clear. We got, we isolated it and then got rid of it. And she was good the next day. I was good the next day. It really is a lot easier if you don't bring too much at a time. Because if you bring a lot, you're probably gonna still feel off. And if the goal is to get your health back as quickly as possible, I would really urge people to bring as little as possible. I don't advise people what to actually do with their stuff. I just want it out of their living and breathing environment, because in the future, some things may be tolerable. So I'm not going to tell someone, exactly what to do. A lot of people just choose to get rid of things. That's what we did. But again, different personalities, different situations, people have to work through this, the way that works for them. But if they want my advice, it will be much more clear and effective if you don't bring stuff with you.
Yeah, that makes sense, because if you don't recover, you always just have to wonder, are you contaminating your new environment? So, yeah.
And I'll take an opportunity to say, when people first move, shortly after, they often have a flare up of symptoms, and that will happen in healthy environments or unhealthy. But in healthy environments, that has a lot to do with when people move. There's a lot of going through aerosolizing things. There's also a lot of stress. There's also a lot of pressure on the new place you moved to, right? Because you had to flee an unhealthy environment, so you're stressed about it. So I do encourage people not to take those initial symptoms too seriously. Like, don't put too much meaning on them. Talk to your physician. I'll talk with people, and it will become clear if the new environment is unhealthy. If it's just some flare ups and, ups and downs, don't make any big decisions, that the place isn't good for you yet. Just kind of, give that a little bit of time. But I could almost predict shortly after a move, people will have symptoms and be very concerned about it, right? Because they just, rearrange their whole life. And I would give it some time. Things can be addressed, resolved, and, it may not reflect on the new environment at all.
What time frame would you typically say give? Is it a 3 week, 4 week, 5 week? What do you see?
Huh. Most, yeah, I have not thought of it in terms of time frame. I try to encourage people to talk to me so that we can talk it through and get a feel for what's happening, what could be contributing, and then sure, I would say if the environment's generally healthy, those types of initial symptoms would resolve within a couple months. Again, with the overall trend being improvement. The other thing I'll mention is reactions that people can have to the tiniest amount of exposure can be extreme, because the immune system has become very hyper reactive and it can do very dramatic things. And how dramatic the reaction is, as long as it's not an anaphylactic reaction where, you're having breathing problems, but like the extreme neurologic reactions and, just really extreme things happen. They can often start after you're out of the environment, because, there's the concept that when you're in it, it's masked. And then when you're out of it, you're kind of all sick all the time when you're in an unhealthy environment. And then when you get out, you're unmasked. So your body will start to respond to things. And I have used the peanut analogy that, we all know somebody could die from a peanut allergy if someone was eating a sandwich across the room. The mold response is not a type 1 reaction that causes anaphylaxis, but it is the same concept. So because someone's reacting extremely does not mean that there was an extreme amount of exposure. Does that make sense?
Yeah, absolutely.
It's immune system. It's, yeah. So
Yeah.
that's also, I try to talk people through that, that just that your body's gonna, it's your immune system is doing what we want it to do. It just has become too vigilant because it was exposed for a while and it had to protect you.
Yeah, absolutely. And I've actually, one of my theories is what I call the theory of angry fat, which is, mycotoxins are fat soluble. Typically, the body sequesters them into fat cells as a means to protect the person who's being chronically exposed. And once you get out, that stuff starts mobilizing out, and it's hitting your bloodstream, and then it's got to sweat out, poop out, or pee out, and
Yep.
that can create a symptom flare, a whirlwind of them. And so I always just try to caution people about that as well.
People do a lot better if you give them an idea what to expect and you kind of coach them, through the process. I think all of us can tolerate a lot more if we have some understanding of what's happening and that it's part of a process. So I think providers who can kind of support and coach people through those really scary times when their body is acting in ways, they've never experienced before. And also, when someone's been sick for a while, their body has kind of gotten used to it. It is far from ideal. But when you try and shift them out of that state, then things start happening. And that can be frightening. When your body's already glitched on you and you're uncomfortable, kind of insecure about, what's going to happen next, um, it's it's harder to tolerate, the whole process. So when you start to do a treatment or, you mentioned sweating, sauna, anything that shifts things can trigger an alarm, even though it's a process to getting to where they would like to be. It's just that getting through that, I think, is also a key time for having a good, close relationship with your provider, because I get it. It's really hard when your body's acting in ways you can't understand and that are severe. So, but you can't always get completely better without things happening. Symptoms happen, and improving the sort of resilience for that process, I think, is also a big goal of mine and hopefully other providers.